investigation by our coronavirus detectives, our public health team. That takes us to 1,417 active cases, with 1,414 of those locally acquired. I'll give you an age breakdown, which I know is always of interest, and just confirms that this really is a pandemic now of the unvaccinated. 216 of our cases are aged 0 to 9, 232 are aged 10 to 19, 348 are aged in their 20s, and 245 are aged in their 30s. Of the new cases today, 91% are under 50. There are 89 people in hospital, and we send our best wishes to each and every one of them and their families, and of course to the teams of dedicated professionals who are caring for them. There are 24 people that are in ICU and 13 are on a ventilator. Only one person that's in hospital has been fully vaccinated. Again, just making the point that if you are double dose protected with either of the vaccines that are available, then you are almost certain to avoid very serious illness. That's yet again another reminder and another really important point to make about the need to get vaccinated and to get vaccinated quickly. Turning to vaccinations, some 29,950 vaccines were administered yesterday. That's in state clinics. That's our busiest weekend day since the vaccination rollout began, our biggest ever. We are now at 2,583,499 doses having been administered through state-run centres. Across the board, we've hit our 60% first dose administered target, and we are well on our way to achieving the 1 million jabs over a 5-week period. We are indeed ahead of that a bit, and we should meet that target ahead of schedule. That's fantastic. We've just got some 343,000 to go, and I'm confident we'll get there and get there ahead of the 5-week mark. Just to give you an example of just how much activity there is in our vaccination system, some 39,000 bookings were made yesterday. That means, Friday I was talking about 50,000 AstraZeneca appointments. I can now pleasingly report to you that there are just 11,000 AstraZeneca first dose appointments available over the next 7 days, and some 2,000 first dose Pfizer appointments available over the next 7 days. Those numbers are steadily getting lower. Doesn't mean that it's any less worthwhile getting online right now as you watch or listen to this press conference. Put your name beside one of those AstraZeneca appointments, 11,000. I'd like to think that when we're standing up here in the coming days, there are no more appointments available this week. Then we'll order more, and hopefully we'll be able to run a whole lot of new appointments in the weeks to follow. But there are 11,000 first dose appointments available right now. Please go online. When you get to honouring your appointment, when you turn up at the state hub, there'll be a doctor, a pharmacist or a senior nurse to speak with you about what AstraZeneca means, and then you can make hopefully an informed choice. You can get that vaccine, you can be back 6 weeks later to get your second dose, and you can be fully protected, both you and the people that you love the most. You won't be helping in the spread of this virus. You will have in fact helped all of us to get to the other side of this and to get to that 80% double dose mark, the mark that allows us to have our freedom back and to live in a very different set of rules, a very different set of circumstances. 11,000 of those AstraZeneca appointments are available over the next week. They're available right now. Please go online and snap those up. I would also just remind people that schools will have been and will continue over the course of this weekend to be communicating with their Year 12 students and Year 11 students who are doing Year 12 exams. Bookings start tomorrow, and the Year 12 or Senior Student Vaccination Blitz, at VCE Vaccination Blitz, begins on Tuesday and runs through until Friday the 17th. That's first dose. I'll just say anyone who's got an appointment with a GP, anyone who is already in a different system, if you like, please continue with those plans. Please honour those plans. We've got capacity to get everybody done, but I think we'll get the task done quicker if everybody works as a team. Obviously, state hubs are a big part of this, a very big part of it. It'll be the overwhelming majority, but there are some people who've got arrangements with their own family GP, and if we can all work together, then we'll get these numbers done. It's not a small thing, but that priority access, priority treatment is absolutely imperative as we get closer and closer to Year 12 exams beginning. And if we can have all of those Year 12s through that process, at least with one dose, some will be double dose because they will have accessed vaccines prior to this program. But that's very important protection for them. It's not ultimate protection, but it is very, very good protection against transmission and against serious illness. And it's a really important part of our vaccine rollout in coming days. Just on testing, there's been a lot spoken, a lot written in recent times about, test numbers and how important it is that we have as complete a picture as possible. The speed with which you get results back to people really is the most important point. You want a good number, you want a good strong number, and we've seen that each day, every day in recent weeks. But it's all about how recent, how accurate is that picture. If you've got tests coming back that are 3 days old, then they're not a lot of use to our contact tracers. That's why it's so pleasing that in the order of 98, 99% of our test results come back the following day. That's the most complete and most recent picture, and it makes the task just that little bit more meaningful, a little bit easier. Nowhere near easy, but a little bit easier than trying to work off data that's days and days old. That's just a long way of saying thank you to our laboratory teams. They're doing an amazing job processing in the order of 50,000 tests a day and doing it really fast. Together with all the people out there in testing clinics taking swabs, it is not only a comprehensive picture of what's going on, but it's timely. It's relevant to what's actually occurring out there because they're being processed fast. That's the metric that we'll continue to be focused on. To that end, though, there were 48,847 results received overnight. So that's a good, strong number for a weekend day, and the 98.6% of those have been provided the day after the results, the day after the swabs were taken. That's a very, very important metric. In terms of testing sites, there are new sites that were opened yesterday in Brunswick, Coburg and Craigieburn. The Coburg walk-in saw about 200 swabs taken yesterday. There's another new site today in Keilor at the basketball stadium. That'll open on Monday apparently, so it'll open tomorrow. Shepparton demand. I just want to give a shout out to the people of the Golden Valley. Many thousands of people isolating at home, many thousands of people caught up in the outbreak, and many, many hundreds of people, volunteers and other staff, doing an amazing job supporting those families and supporting a whole lot of essential services and functions throughout the Goulburn Valley. Can I just give a shout out, obviously Deb Abbott and her team at EMV, but can I give Susanna Sheed, the local member up in Shepparton, a shout out. I've spoken to her numerous occasions. She's been on the phone to so many of my colleagues, pushing us, making sure that we understood exactly what was going on in Shepparton. Very resilient community, but sometimes things just become a bit overwhelming, and it's very important that there's appropriate support, and that's what we've done. And she's a great champion for her local community, and we're indebted to her for that constant feedback and her hard work. Her electorate office has essentially become a relief centre, and her and her staff should be very proud, and we're very grateful for the partnership we have with her, delivering for her local community. In Shepparton, demand is starting to wind down. Those day 13 tests are unfolding. There's some 36,734 tests that have been conducted in Shepparton since the outbreak began. So that just gives you on one metric a sense of just how big a task and just how much work has been done in the Goulburn Valley. We're very grateful to those communities. They're proud and strong, they stick together, they look out for each other, and they're much better for that. We're there to help as well, and that's why there's been such a significant presence. I just want to remind everybody, just before I throw to Minister Donnellan to speak about some other important matters, I just want to remind everybody that if you would be without pay, if you would be missing out on a shift because you went and got tested and you had to isolate until you got your results the following day, there is a $450 payment available to you. So if you're a casual worker, if you don't have annual leave and sick leave to fall back on, in order to do the right thing by the rest of us and go and act on your symptoms, go and be immediate with a sense of urgency to act on your symptoms and get tested, if you'd be out of pocket, then there is a $450 payment. It's essentially no questions asked. We make it quickly. We've made thousands of these payments because we know that many people who are in less secure work circumstances, and that, the absolutely toxic nature of insecure work, this has become well known to us, well known to all of us. So that's why that $450 payment is there. In the event that you test positive, then there's a further $1,500 payment available to you. So we will stand with you, we will look after you, and you should come forward and get tested for your family and for every single family. And as I said, we have made thousands of these payments because we know that this virus has ripped through so many different communities and so many people in insecure circumstances, employment circumstances, and uncertain financial circumstances, where there's not thousands and thousands of dollars in the bank for them to fall back on. We want them to do the right thing and never have to choose between feeding their family and protecting every family. That's why those payments are there. I just remind you, those payments and the details, it's all on the website. If you need that funding, it is there. That's what it's designed for. Those payments are there to be made, not to be sat on. Now, yesterday, the Minister for Business Support, Mr Pakula, made a whole range of announcements in partnership with the Commonwealth, a very substantial business support package, and it seems to me that there's been very strong feedback, positive feedback from those who are constructive about these things. You know, we can't provide everything, we can't replace everything that is lost through these sorts of measures, but it is a very substantial package of support. We're grateful to the Commonwealth for their partnership, and there's been, both to me personally and I think in the media, quite supportive commentary about the nature of this package. The companion piece of work, if you like, is a comprehensive package to extend the different measures and programs we have in place for the most vulnerable, those in our community who don't necessarily have a vecchi or someone like that to stand up for them, people who really do it very, very tough, and people for whom the burden of this virus can be particularly acute. On that basis, we've extended and made further decisions to extend all sorts of support to those in our community who often have the least power, those who are the most vulnerable, and those for whom this support is so meaningful. To take us through those decisions, I'll now throw to the Minister, and then Jerome will take you all through that outbreak map as he does always, and then we're happy to take any and all questions you have.
Thank you, Premier. This is very much about extending the program we already had for vulnerable communities. Earlier this year we announced funding of $30 million, and this is very much about extending that $27 million package. And the package is very much about putting our arms around those vulnerable communities, very much about ensuring they can put food on their plate, to very much take care of the basics, because many of them have simply no opportunity to receive, Commonwealth payments and the like, have limited savings and so forth. So specifically, the package includes $3.7 million for our partners Red Cross and local government in relation to continuing to provide the isolation packages. And the Red Cross has done a marvellous job. I think 4,300 of those have gone out in Shepparton in recent weeks. But it's also about recognising the great work that local government does with us, of reaching into those communities and knowing what those communities need on the ground in terms of food relief and ensuring the appropriate and right food gets there. There's also $6 million set aside for Food Relief Reserve, which is specifically for our larger providers to provide food to smaller charities throughout the whole of Victoria. So these are your major providers like your Food Shares, your Oz Harvest and alike, to ensure that we can get food out to some of the smaller agencies presently who may not be able to actually reach out and get that food presently. So it's about very much about ensuring that we have that capacity there, and that can be drawn upon any time, and it might actually in some ways cover things like needing extra staff to ensure you can actually get food out, because volunteers during this period of time may have dropped off. And it also recognises the fact that donations, whether it be from the local community or supermarkets, have dropped off. We're also extending our emergency hardship support package and as asylum seeker support, $5.9 million plus another $2 million, to recognise that many of these people in the community simply don't have savings. They have no opportunity to receive Commonwealth income and are very much in an incredibly desperate situation, and they need to put food on their plate, pay their bills and alike, and that is very much about acknowledging the need for this for both temporary and visa holders and those undocumented migrants. There's also $7 million for our cold task force, and that's very much about both supporting food relief but also ensuring that the message and the support gets out there for people to be vaccinated, people to be tested. And our cold task force has done a marvellous job of reaching into the community, because the skills they have, the connections they have and the understanding of culture they have, and the most appropriate way to actually reach out and ensure that we're protecting the most vulnerable in our community. There is also further funding for family violence and support for single women. Now, The family violence, as we know, during this period of time, it has increased. There is no doubt about that, and this is very much about providing that support and recognising the continuing need to support people and ensuring that, to get out of your house. Really, if you're in that situation, to put it simply, that's a reason to get out of your house. And we need to provide the support, we need to provide the brokerage, and we need to provide the accommodation. That is one of those reasons we very much want people to be blunt, to leave their house if they're in those difficult situations. So this package is very much about recognising the acute impact, obviously the lockdown, the fact that we're not at a level in terms of community vaccinations we need to be, and we need to continue to buy time and support those vulnerable communities while we wait for that vaccine rollout to continue. Thank you. And I'll pass over to Jerome, sorry.
Thanks, Minister. Good morning. 183 new cases in the community today. That takes us to 1,417 active cases of COVID in the community. Of the 183 today, 94 of those are in the northern suburbs, of which 53 are in the Hume, LGA, and 17 in Moreland. So we continue to see a very strong concentration in our northern suburbs. We have 15 new cases in the western suburbs, including 21 in Wyndham. We have 11 cases in the southeast, including 4 in Casey and 3 in Kingston. We have 9 cases in our inner city area, in the CBD, so 8 in Melbourne CBD and 1 case in the city of Yarra. And we have a couple of cases in the eastern suburbs and 2 cases in the inner south. There are also 6 cases in Shepparton, and finally we have 1 case in Wodonga. We'll come on to that in a moment. That takes us to 175 cases in total. There are 8 cases that are still under investigation. They dropped late last night. So the overall outbreak map continues to be very, very clear, very heavy concentration of community cases in the northern suburbs, in the western suburbs, and we have a significant number of teams working in those areas to support people living with COVID at this point in time. We continue to see a small number of cases in other parts of our suburbs, and again I stress to all Victorians and all Melburnians, please be aware that we are seeing more cases, and that means there is a greater risk of you encountering people who may have COVID, and all those COVID safe protocols are now such an important thing for all of us to be using at all times. One of the cases last night is a truck driver who lives in Wodonga. He has a number of interstate exposure sites, but none in Victoria, and as soon as he became symptomatic, he immediately got tested and isolated at home. My thanks to him for doing that so swiftly, and a critical part, of course, of us continuing to support the interstate freight industry. In terms of other couple of areas of interest, we mentioned yesterday Japara Aged Care in Carrum. I'm pleased to confirm that we've had, although there is 1 positive staff member who was double vaccinated, there have been no other positive cases identified in that facility. All the resident testing and staff testing has come back negative. We'll of course continue to support that site over the coming days. We do have a positive healthcare worker at Northern Health. The infection, we believe, was acquired outside of the facility. We're just working through potential exposure sites and other staff impacts. But again, as we've seen in the last few weeks, strong protocols within our healthcare system around use of PPE and COVID safe protocols, we believe should reduce the number of people impacted by that exposure. And my thanks to the whole Northern Health team for their swift response to this late yesterday and over the coming days. We have found over 30 cases now in a very small concentration in Roxburgh Park and Coolaroo, a small retail strip. A lot of really close community engagement. My thanks to the local traders and the local community for coming together for us to explore and understand better the nature of transmission in that area. There is a strong level of support in place to support not only those cases but also those local retailers and local businesses, and we are putting out more messaging. I would encourage people, particularly in that Roxburgh Park, Coolaroo area, if you're using some of those retail strips, please come forward and get tested. We really want to understand how far that transmission may have gone through. We mentioned the other day the Box Hill construction site. There have been a couple of other cases coming in today, so we now have 63 cases associated with our Box Hill construction site, and again it shows how quickly those numbers can start to grow at those really intense workplaces. We also have another construction site at Classy Kitchens in Craigieburn, where we've identified 14 cases, and the positive cases currently in the first 24 hours are more than half the people who are working on site at various points in time. So we're seeing a very high attack rate, and it's a message to all those who are continuing to operate businesses at this time, those essential businesses that we are maintaining. So important that your COVID safe protocols are as strong as you can possibly make them. Now that we're seeing levels of community transmission that we've not seen for a long time, you need to ensure that all your workforces are as well protected as they can be, and we avoid these amplification events at individual work sites. There are literally hundreds of people, thousands of people on the ground dealing with this COVID response across Melbourne in particular, and of course in other parts of our Victorian community. We've got teams from our health services and our community health providers. We've got local councils. We've got colleagues, as the Minister's indicated, colleagues from our family and community support teams out there working with communities to support them on the ground. Yesterday we did over 900 visits by authorised officers for people isolating to make sure that they were getting the support that they needed, and again, pleased to report really high levels of compliance. And of course we have literally thousands of people working in our vaccination centres and testing centres. We will continue to provide and drive all that support because we are so determined to contain as much as we can these outbreaks we're seeing in certain parts of our community. But I would like to thank every single person who's out there, all those volunteers and those frontline staff who are doing the hard yards day after day after day. It is so important they continue to do what they do so that we can support the people who are living with COVID at this time and minimise the onward transmission as we continue to vaccinate as many Victorians as possible. I would like to make a particular shout out to the work of our industry engagement teams across government. Over the last 4 weeks, they visited over 600 construction sites to ensure that those COVID safe protocols were being well adhered to, and that people on those sites knew exactly what they had to do to keep those sites safe. Over 90% of those sites visits went exceptionally well with really strong processes in place, so my thanks to the whole industry and to all the guys working on site for maintaining those really strong disciplines day after day after day. But we have found a small number, less than 10%, who weren't compliant. 54 sites where, particularly in that light commercial construction sector, where mask wearing wasn't as strong as it needed to be, site registers were not as strong as they needed to be, cleaning arrangements were not as strong as they needed to be. And it's in those kind of gaps that we can see cases like the Box Hill construction site suddenly jump to 60 plus positive cases. If you've got those gaps in your systems and protocols, that's where COVID will get in and will spread rapidly across your workforce and across your site. We have, of course, issued a number of enforcement notices to those sites who are not complying. But again, it's a big shout out and a big call out to everybody. Thank you for the work you're doing to keep your messages, to keep your systems and your businesses safe. But please continue to do all you can to keep them as safe as possible now that we're dealing with the Delta variant. Finally, of course, or two more things, in terms of vaccination, we're of course delighted to be launching the VCE vaccination drive from tomorrow morning. For all the schools will be communicating clearly to VCE students, both Year 12 students and those Year 11 students doing their VCEs, or doing VCE subjects this year. You will get advice about where to call and how to take one of those bookings. The call centre opens tomorrow morning at 8 o'clock. There are sufficient spaces for everybody. We have reserved spaces for every Year 12 and Year 11 student doing VCE subjects to make sure that you can get your vaccination between the 7th and 19th of September. So although I do want people to book in, you will need to book in to get access to those slots. If you're not getting in at 8 o'clock, you'll have the whole day, the coming days, to make those bookings, and those vaccines will be reserved for you to have between the 7th and the 19th of September. So don't stress, we are there to get it done, and we'll work with you over the next couple of weeks to make sure you get your vaccine before you go to your first VCE subjects and before the GAT exam. Finally, again, as the Premier said, getting tested is our way through this. Getting vaccinated is important, and getting tested at the early signs of symptoms. There are $450 test isolation payments available, and I'm pleased to confirm that over 6,000 people a day are applying for those test and isolation payments. If you need that extra bit of support to get tested because you can't afford to miss a day of work, you can't afford a shift, you need that extra income, then please get tested, knowing that 6,000 people a day are applying and getting those test and isolation payments, and we will continue to honour that because it's the most important thing now is that we stop the onward spread of COVID whilst we get Victoria vaccinated. With that, I'll hand back to the Premier for questions.
Thanks very much, Jerome. We're happy to take any questions you have.
Premier, if we could start by asking you about some of the Prime Minister's comments in the paper today. He is telling Australians that by Christmas all borders will be open and they'll be able to travel and see each other. Is it up to him to be making those announcements, or should the Premier have the final say?
Well, look, right, without getting into a debate about who's responsible for what in our federation, I think the most important thing is that surely we could all agree with that. We could all work as hard as we can to make that real. Getting vaccinated is an incredibly important part of that. As Jerome just said, and as I've said, I don't know how many thousands of times now, getting tested as soon as you feel sick, following the rules. Even though we're not chasing zero anymore, we are chasing the lowest number of new cases every day. Every 10 cases that are avoided is a hospital admission avoided. Or put it the other way, every 10 cases that we stand here and report, that means one extra person at least is finishing up in hospital. Not only do I want Christmas to be as close to normal as possible, I want to do everything I can and appeal to our community to join me in that work to make sure that the tasks, the burden, the challenge that particularly our nurses will face in the coming weeks and months, let's not make that job any harder than it already is. It's incredibly difficult, and if we all play our part, then there's a lot of people who need not finish up in hospital. That's an important part on the way to a Christmas where hopefully Australia's opened up and we have got 80% plus of our community through the vaccination program. I think getting to 80% vax is much more important than whether you can go to Queensland, frankly, or whether you can go to Perth. I'll leave those border arguments to others. I want to get our community through the vaccination program, and there are 11,000 AstraZeneca appointments available over the next week, and you can put your name beside them right now if you go online. There's 2,000 Pfizer as well. I reckon they might be already snapped up in the last 15 minutes, but the best vaccines are one you can get today, and there are thousands of appointments available.
I asked because earlier in the week you said it's a possibility we'll still have that hard border with the New South Wales at Christmas time. So
we'll have to look at what's happening in terms of the epi picture there and virus status, all those sorts of things, just how much pressure is our health system under, how much whereabouts are they up to in terms of the amount of virus. I would hope that's not my preferred outcome. The preferred outcome, as I indicated on Friday, where we'll have more to say quite soon about getting Victorians who've been stranded in New South Wales home. We think home quarantine may be, and using some technology may be, an important part of that. We'll have more to say about that. I don't want people locked out of their state, and I don't want people locked in their homes either. That's why getting vaccinated is so important. But between now and then, we've got to keep these cases as low as we can. Otherwise, we're just making the job of our nurses even harder. Surely no one wants to contribute to that. That's why the rules matter. So it's no visitors to your home. So you shouldn't be letting anyone in your home, and you shouldn't be going to anybody else's home. That's just the way it is. There are no circumstances under which these rules don't matter. They absolutely matter every day for everyone. Otherwise, we see more and more cases and more people in hospital.
Premier, we've heard reports that the Acquire call centre wasn't following hygiene standards. They were hot desking, too many people were working at once while fielding those vaccine calls, and there wasn't sanitizer available, and obviously the cases there are growing. What's your response to that, and has an investigation been launched?
Well, as Jerome indicated the other day, the department is looking at those matters. Every business needs to comply with the COVID safe plan, regardless of the work you're doing. Doesn't matter whether you're working as part of the pandemic response or doing things that have got nothing to do with the pandemic response. COVID doesn't mind what you're doing. Points of weakness become where this virus goes. It goes to where rules are not followed, whether it's a call centre or a building site. If there's any sense of weakness, and that's not to say that every infection someone did something wrong, just making the point that often if you're doing the wrong thing, the virus will find you out. It absolutely will. So I think we're having a close look at that. They're not direct employees of government. They're a firm that's been subcontracted. I'm not certain about the exact facts there yet, but we're looking at that matter closely, as people I think would expect us to.
Premier, the Moonee Valley Racing Club said that they're in discussions with the state government about the possibility of the Cox Plate coming with a no jab, no entry policy. Where are discussions currently at with that?
Oh, look, we're having discussions with all manner of different event organisers, large and small, and we'll have more to say about a range of events quite soon. But I think it is highly likely. In fact, I'm certain that there will be a whole range of events once we get through the 70 and 80% double dose thresholds, once we get past those important milestones, that will be open for vaccinated people only. So we're going to move from a situation where, to protect the health system, we've got everybody locked down. We're going to move to a situation where to protect the health system, we're going to lock out people who are not vaccinated and can be. If you're making the choice not to get vaccinated, then you're making the wrong choice. You're making the wrong choice. And for safety's sake, and for the back to that point about how much work our nurses have to do, as this becomes absolutely a pandemic of the unvaccinated and we open everything up, it's not going to be safe for people who are not vaccinated to be roaming around the place spreading the virus. That's what they'll be doing. So there's every reason to get vaccinated. And there are appointments available, and there'll be even more appointments available throughout September, October, November. Let's get to those thresholds as fast as we possibly can. But yes, there's going to be a vaccinated economy, and you get to participate in that if you are vaccinated. Now, that's not right now because, of course, there's many more people who want to get vaccinated than we actually can get through the system. But we're going to get to a point where everybody who can get vaccinated will have been offered the chance to do so. And we are not going to have a situation, well, at least not in Victoria, where we lock the whole place down to protect people who won't protect themselves. Go and get vaccinated. There's 11,000 AZ appointments available this week, 2,000 Pfizer appointments available this week. We'll have more to say with those additional stocks coming in from overseas, but I want to run that down to zero so there are no more AstraZeneca appointments, hopefully very soon, and we can order more and we can keep pushing that. I just again remind people, the Prime Minister has written to everybody who's 60 and over and indicated to them that you are eligible for AstraZeneca, and if you want Pfizer, then you will be in the queue behind everyone else. That is to say, you'll be in the queue behind 12-year-olds, because they can only get Pfizer. That is the position of the Australian government, and I support them in that. So why would you wait? Why would you get in a queue that might take months to get to the head of that queue? Why would you do that? You would instead make one of those 11,000 appointments, come to a state hub, there's 55 of them, 5 of them are drive-through even. Only ones in the country, I think. You can talk to a doctor, a nurse or a pharmacist, go through the process, be informed of all those issues, make an informed decision and get yourself protected. You'll be double vaxxed 6 weeks later. Help us in our race to 80 and help us get open.
Jerome had mentioned that there was some...
And get yourself to the Cox Plate or any other events. There'll be many, many events. Once we get past 80%, that will be open to the vaccinated only.
Jerome had mentioned that there were some gaps with COVID-safe plans at construction sites, and we obviously heard about what's happening at the Acquire call centre. Has there been a considerable...
Yeah, I wouldn't necessarily put an equivalence on those. I think we have determined that there were some gaps and some non-compliance on some building sites. I think the call centre matter is one that's still being looked at, and when there's an update, if there's an update to give you, we will. But the point is, some people make a judgment that they don't have to follow the rules and that they can have, there or thereabouts COVID-safe practices. The key message here is this is Delta, and it will find any point of weakness. And it's not just one person who gets it. It finishes up becoming dozens and dozens. And, 63 people infected on a building site, chances are, the maths of this again is undeniable, half a dozen of those people are going to finish up in hospital and quite unwell.
Has there been a considerable or a noticeable decrease in the number of businesses that are, fully compliant with their COVID-safe plans, and is that a bit of a weak spot?
No, I wouldn't say that. I'd say that there's a sense of fatigue across the community in many different places. No one's enjoying these rules. No one's enjoying the fact that we have to prove as stubborn as this virus. Like, it's not going away until we get 80% of people through the vaccination program. And even then, it's going to be very challenging because we will open up and it will tear through the people who are not vaccinated. That's the peak. That's the spike that we're going to have to manage. That's where New South Wales, they're in a very challenging set of circumstances now, and we send our best wishes to all of them, particularly the nurses and other health professionals who'll be dealing with what they're dealing with now and what's headed their way. I wouldn't say that it's a point of weakness any more than it's always been, but I would just say, with the greatest of respect to the construction sector, just as one example, like, we hope once we get to 70% single dose to allow more construction activity. We know how important that is for jobs and livelihoods. But this industry's got a part to play in that, and every person who's not doing the right thing makes it harder for me to make decisions and for the Chief Health Officer to advise me that it's safe to expand that industry or any industry. So everyone's got a part to play, and I just, we've worked very hard to support people in that industry over a long period of time now. Probably no government's done more building than the one I'm proud to lead. But I just send a message to everybody involved in that industry. Safety is very important. You know that, and that's why you've got to wear your mask and do all the other things.
As you say, this will be a pandemic of the unvaccinated, particularly once we get to 80%.
It already is pretty much.
And a lot of people's attention and focus essentially has turned on what will it mean for children. And there's obviously a lot of evidence and research to suggest that children don't get as sick if they're if they're infected with COVID. But would you essentially support separate modelling done for National Cabinet on what opening up at 80% would mean for kids and kids under the age of 12 specifically?
I think it's very important not to assume that work and those considerations have not formed part of National Cabinet's decision making. Like in modelling, you have to assume certain things. That's the whole nature of modelling. It's based on, as best you can, past practice, past experience, things that are happening right now. It's as dynamic as it can be, and that's why it's constantly refreshed. But I think it would be wrong to assume that what this all means for our youngest Victorians and youngest Aussies hasn't been included in this work. It absolutely has been. And you'd need to speak to the Commonwealth Government, and they may well be happy to provide further information and further details around that. But Doherty's looked at the fact that kids are not vaccinated. That's been a known thing. That's been a constant for quite some time. Now that may change next year. It depends on some of the work that's being done in other parts of the world around a childhood vaccine. But all the decisions that have been made in the national plan, the 70 and the 80, what's possible, and I think it's much more toward the 80 than the 70. That's certainly the experience for jurisdictions that have got higher caseload rather than very low caseload. So basically New South Wales now, Victoria soon, and the ACT somewhere in the middle. 80 is going to be much more meaningful than 70. I think all of those matters have been taken into account as parents and as all of us would expect.
Premier, where are we at exactly today with vaccination rates? Is it past 60%?
We are past 60% first dose, and that's a fantastic milestone, and I think we're going to get to the 70% first dose a little quicker than we had thought. 23rd of September was on or about, but we've seen very significant take-up in recent days. This last week has been a very strong week for us, as evidenced by yesterday, the biggest weekend day that we've had. Hopefully today can be even bigger than that. But look, I don't get a sense that there's hesitancy out there. I think people want to come and get vaccinated. The fact that during the course of this week I started off talking about 72,000 AstraZeneca appointments, then I was talking about 50, now I'm talking about 11,000. So the message is getting through. The vaccine that's available to you today is the best vaccine. These all go through a TGA process. Often we're critical of the TGA because they take so long to do things. But there should be comfort in that. It means they're doing the job properly. They're looking at things very, very carefully. These have been approved. You do need to go through an informed process. That's why we're supplying senior health professionals to take you through that. But book an appointment, and let's, just as we've got to 60% first dose, let's get to 70% first dose as fast as possible.
To help ease the frustration and the fatigue, can we explain to double vaccinated Victorians what freedom might look like? Are they going to be able to sit in a pub? If you can prove that you've had 2 doses, will you be able to have a picnic with friends and family outside?
As I said yesterday, we're going to have some pilot work done quite soon, because you've got to make sure that the technology works and the whole system is ready to go. That'll be predominantly outdoors. We're already talking with the hospo industry, for instance, so there will be trials. Hopefully we can get regional Victoria out of the lockdown next week. That's great news for regional Victoria, but it would also be a pretty logical place for us to do some of this piloting work. Doesn't mean that regional Victoria would only be open to vaccinated people. It would be open to everyone in regional Victoria, but we would use that as that's a safe place in where we can do some of these trials and pilots. I can see a situation as we get certainly 70 and then definitely 80. We would have some outdoor drinking and dining. We would have all sorts of different activity that you wouldn't even think of now. The bias will be towards indoor. But for fully vaccinated people, there'll be more and more things that we can do. That'll move inside. The economy, as best it can, will operate as close to normal as possible for people that have had 2 doses. So everything from restaurants, cafe, retail, sporting events, theatre, the list goes on and on. That's what we're aiming to. That's what we're aiming to build, and that's what I'm confident we'll be able to do.
And is that just using the the check-in app, you'd essentially download your COVID vaccination certificate and it would show a tick. Is that
It's
how
like,
it
yeah,
would
well,
work?
there's a lot of work going on between technology ministers, and I think it's fair to say that there's a leading partnership between Victoria, so Minister Pearson and Minister Dominello, and the Commonwealth. I think Stuart Robert is the relevant federal minister, and they're all working very hard to make sure a National Cabinet got some briefings on this. We'll be ready to go later on this month, where you'll check in and there's a compatibility. It's essentially the same process that your QR in, and that also tells the vendor, the publican, the restaurateur, whoever it might be, the owner of the business, tells them whether you are vaccinated or not. They don't store that information, but you either get a tick or a cross, and on that basis, you're either allowed in or you're not.
With vaccination rates more forward than you originally thought, what will restrictions look like perhaps next week for regional Victorians?
Well, regional Victorians, we hope to end the lockdown as soon as we can. So I haven't got advice to do that yet. As you well know, we look at the most contemporary picture, and when we get all that data in for what's occurred this weekend, what occurs earlier this coming week, hopefully we can make a decision that takes the lockdown off in regional Victoria. I would just indicate that Shepparton is in a slightly different position, and I think the people of the Golden Valley know that, what they've been through. So it might be safe and except for Shepparton right now, but I think they would be catching up quite soon thereafter. But they're not decisions that have been made yet. That would be an end to the lockdown. So the 5 reasons to leave home, so 4 reasons plus going and getting the jab, would no longer apply. So there'd be a greater freedom of movement. There'd be a greater economic activity. They would be in a form. They would be open. It's not going to be, back to normal, because there's still we have to assume some virus in regional Victoria, and there's also the risk of virus being exported from Melbourne into regional Victoria. And you would recall last year we had a ring of steel around Melbourne. I've currently got all of those police officers and more, I should say the Chief Commissioner does, up on the Murray, making sure that we don't have further incursions.
Have the Feds given an indication of when we will be able to get a portion of those 4 million extra Pfizer doses?
No, not yet. I'm just going to get a... Jerome, you want to talk about you're going to pass me that water even better. Thank you. No, we don't have an indication about when that's coming to us, but I think we're going to get about 1 million. Carry on.
Yeah.
I'm fine.
That was my only question about that.
If regional Victoria is looking at potentially coming out of lockdown next week, say for Shepparton, is there an argument to be made that we could look at the vaccination stats of people in regional Victoria, separate them from metropolitan Melbourne? They might be getting to 70 quicker than the rest of us.
Yes.
In which case we could see those pilot hospitality programs and the like open sooner there?
Look, I wouldn't rule that out. I wouldn't say that's necessarily a definitive part of our plan, though. Obviously, it's very important not to, in too many senses, treat regional Victoria and metropolitan Melbourne as completely separate things. They're not. There are linkages. There's still going to be people travelling for authorised reasons, for perfectly lawful reasons. So that means that there's some risk. But the number of cases in regional Victoria are very, very low, save and except for Shepparton right at the moment. But our hope would be to have the lockdown off in regional Victoria as soon as possible. That won't be a full return to, everything's open at maximum capacity. It would be less than that, but I'm sure both regional Victorians who'll have greater freedom and regional Victorian businesses, which will have much greater takings than they do now. They'll be well beyond the kind of takeaway that they're doing now, for instance. That'll be very welcome news.
The Chief Health Officer yesterday flagged supermarkets as real risks.
Yeah.
Is there an argument to be made that the curfew is putting greater pressure, basically condensing the number of people that are able to visit the supermarket within a restricted period? Is that adding to the... I
don't have advice to that, and I'm sure that the argument will be made because there are many people who see the curfew as, something to score political points on. These are the facts. Road and public transport travel, so the number of cars moving around the place and the number of people on public transport is down 15 to 20% during the curfew hours. That's what the latest data that I've been briefed on shows. What that tells me is it wasn't people doing their shopping at midnight or 1 a.m. It was people going and visiting others, which they are not allowed to do. And they were taking the virus with them, perhaps. So that's what the curfew achieves. It means less people out and about for unlawful reasons. It's very binary. You're going to get caught because there are patrols everywhere. There are literally patrols everywhere. and you'll be pulled over and you'll be asked, righto, curfew on, it's midnight, why are you out? And if you haven't got a lawful reason, then you get a fine, and the fine is particularly significant. That's what the curfew achieves. I have no advice that it's making it more dangerous. I think quite the opposite. Quite the opposite. And look, and I apologise to people who can't go for a jog at 1 o'clock in the morning, and I apologise to people who can't go to the supermarket at 3 a.m. You know, I think there's small prices to pay for essentially preventing a lot of people who think the rules don't apply to them going and visiting others. That's what the curfew makes harder. It doesn't make it impossible, but it makes it harder.
Can you ask Jerome?
Absolutely you can.
Please, if that's okay.
Sorry.
Do you have any information on the 2 security guards at the Broadmeadows Detention Centre who've tested positive to COVID?
Not really, no. We can certainly get the information for you on that. We know that there is a case who tested positive who works at the detention centre. We've of course done the usual full testing regime of both the residents at that centre and the staff who are there. That work started I think a couple of days ago. We've had no positive tests come out of that facility at the moment, which is good news. And of course we'll continue to maintain that wider support around there.
And do you know how, I guess, in close proximity they were to the asylum seekers in that facility?
Yeah, so the individual was a security guard who worked on the outside facing parts of the premises, so no contact, as my understanding, no contact at all within the facility or any of the staff who work with the people who are in the facility.
Do we know how the Northern Health worker caught the virus and the circumstances around it if it wasn't in the hospital?
Yeah, so we're still doing the full contact tracing with that individual to understand exactly their movements. They do have a very regular testing record, and that included they got tested very quickly during their early symptomatic period, so we're pleased about that, and a number of negative tests before their positive test came through yesterday. So we're just establishing the links they've made. I don't have an exact link yet in terms of where they acquired from, but a number of leads of investigation at this point in time. We don't at this point believe there was any transmission or that there was an acquisition within the hospital, but of course we're doing the full thing with Northern's really good staffing records and working arrangements. We'll work out exactly who should be furloughing and how we support them during that period.
And no other staff there have caught the virus?
Not at this point. So obviously we'll work out exactly who the staff were that were in contact with this individual, and there will be some staff, absolutely. They'll be furloughing, they'll go through their testing protocols as per normal, and then we'll assess what risk we've got for that hospital.
In your earlier spiel, you had advised everyone who visited a retail strip in Coolaroo to get
Yep.
tested. Is that where the Custard Suites is? Or
That's
is
right.
That, yep.
That's right, yeah.
Is there any further information on the person in hospital who is fully vaccinated, whether they're in ICU?
No, I don't have that information. I can certainly come back to you on that tomorrow.
And the exposure site in Ballarat, the university, the case obviously
Yep.
doesn't reside in Ballarat, is that right?
That's right. So we have a case that resides in Ballarat. There are a limited number of exposure sites, and we're treating now as we normally would. So I think, as the Premier said, there absolutely will be identified isolated cases within regional Victoria, and this will be a real the critical part for us over the coming days is making sure that those people continue to do the hard yards of isolating effectively. As we always do, we provide a lot of support to people, whether they're in Metro or in regional Victoria, around ensuring they can isolate safely. If they need to go to alternative accommodation, we'll arrange that, but we'll manage that as we normally do.
How many cases are now linked to the Acquire call centre? I think it was 25 yesterday.
Yeah, no increase today, which is good. So we still have those initial 25 cases. Most of those are staff within that particular call centre. There are some household and other primary close contacts of those individuals. And to your question earlier, it is of course a significant concern that you see that many cases in one workplace setting, and there's a number of measures we're taking to both with the operator to understand the conditions that those staff are working in and the arrangements they had in place. Anything else from me?
Thank you.
No? Great.
Premier, just on that infamous...
I thought we were done.
One more.
Oh, okay.
Just
No
on
worries.
that infamous video of Nadia Bartel allegedly breaching COVID restrictions and, yes, doing other alleged things. Have you had any update from Victoria Police on where they are up to with that investigation?
Not specifically, but it would be my expectation that that matter would be treated no different to the engagement party. Like, we had a video of people doing the wrong thing. It wasn't obtained via a contact tracing process. It's not a matter of, breaching confidence and calling into question what people tell us truthfully and fulsomely when they're contact tracing, and that's worth much more than any fine we might give out. This is information, this video, no different to the engagement party, is out there in the public domain, and it would be my anticipation that every single person at that house would be getting a $5,500 fine. because I'm confident these really are decisions for the Chief Commissioner, but I'd be absolutely certain that he would want the law applied equally, regardless of, whether you were used to be related to a footballer. Like, this is everybody's business. This is everybody's business. And people should be treated equally. That'd be my absolute expectation. Otherwise, it wouldn't be fair, would it, on those people at that engagement party who have all been issued, as I understand it, except for the kids, they've all been issued with a $5,500 fine. This should be no different. Also see some stuff on social media about other people potentially visiting that house. Like, no visits means no visits. Stay at home. Stay at home. That's what the rules say. And that's what will keep us safe.
Premier, again, we're ahead of schedule with the vaccination rates.
We are.
Going up. Any possibility that Melbourne may see restrictions eased before that September 23rd?
Now, to your earlier question, if we get... it is supposed to be on or about the 23rd. I think it'll be a little earlier than that. The question is just how much earlier, and every appointment that gets made, every shot in every arm between now and then will bring that date forward. So that's another reason to go and get vaccinated, and don't wait for, don't wait next month. Don't wait till some other time. Act on that now. That'll mean that the date comes forward a bit. We can't be certain exactly how much earlier it'll be, but all those things that we have already indicated that we're working on for what was on or about the 23rd, if that can be a bit earlier, then great. And we've also, as you would remember, we've also made some commitments about whether it's outdoor recreation, what else might be possible for us to fold into that 70% first dose marker. Again, there's two really important points. The more people get vaccinated, the quicker we'll get to the 70% mark. That's obviously a good thing. Secondly, the harder we all work to follow these rules and limit the cases, the more options we'll have. So those two things work together very, very closely. That's why it's so upsetting for those who are following the rules, millions of Victorians, to see such shameful examples of people who aren't. That's what makes people angry. It's what makes people... I know we're all under the pump, and sometimes the mask will slip down, and the innocent mistakes like that, those things happen. But when it's much more obvious than that, people just making a judgment that the rules don't apply to them, that it's for somebody else to follow the rules, that's what makes people angry, I think. And so it should.
So just to clarify, if we do meet that target earlier, it'll still be that September 24th?
No, I think we may well be able to bring that forward. And we've been clear all the way along. It's on or about, and if we keep vaccinating the way we are, and if all those appointments I've talked about today get snapped up really quickly, then we can get to that marker, that 70% first dose, quicker than otherwise. So I'm not entirely sure whether it'll be the 22nd or the 21st or the 20th or whatever it'll be, but it'll be, I think, before the 23rd if we continue at this rate.
And in addition to bringing it forward, are you saying that we could also potentially see some greater freedoms added to the list of what we're able to do beyond the extending 5K to 10K and extending 1 hour exercise to 3?
Yes, so what we said on Tuesday, I think it was, you'll I'm sure check that for me, I think it was Tuesday, we said that we would do 5 to 10, 3 hours instead of 2 hours, all of those changes. The construction industry going to 50% for those who are vaxxed, all of those sorts of changes. We also indicated that whilst we weren't making announcements in specific terms, we were also looking at what else could be done, what else could be part of that. And if there's further easing that we can do, further freedoms, albeit they will have to be modest. It's not a massive Freedom Day thing. But hopefully we can get to the 23rd earlier than that 70% mark, and we can not only deliver on the things we've already committed to, but some more, and that's the work that's going on now. But that really is in the hands of every Victorian. Do we do everything we can to keep the cases lower than they'd otherwise be? And do we go out and get vaccinated and act on that? If we do, then not only will 70% come sooner, but we'll be able to do more easing on that day. So we'll be back this week to talk hopefully in positive terms about regional Vic, and hopefully more and more people snap up those appointments, get vaccinated, and we can be to 70% single dose faster than otherwise. That's the basic logic of this, and that's where, I think people's frustration is often coupled with that sense that there's nothing they can do to impact this, that it's happening to them and they're not part of it. Well, we are all able to influence where this goes. Following the rules means less virus means more options. Going and getting vaccinated, absolutely. gets us to these milestones quicker. And of course, going and getting tested, if you feel sick, as soon as you feel sick, that's a critically important part of this as well. So many millions of Victorians are doing such an amazing job. I am proud to lead such a resilient state, to lead a state filled with people who are doing the right thing and know that we're in this together, and the acts of kindness, the support for each other, it's inspiring. It's also infuriating though when we see some people just doing the wrong thing, assuming that they can, some sense of entitlement or privilege. No, don't do anything that might put more people in hospital. Have, for heaven's sake, enough regard for our nurses. If you have no regard for anyone else, at least have regard for our nurses, and don't do anything that might make their job harder. That's a pretty simple message.
Can I ask, Federal Minister Stuart Roberts said this morning on television that the national plan, including that 70 to 80% target, is subject to change. Is that your understanding?
I didn't see his comments. I'd need to check the context in which he meant that.
In terms of, is your understanding that this 70 to 80% target is really set in stone from a National Cabinet perspective?
Well, I'm trying to be careful not to... Well, that is the plan, but, you know, if you'd said prior to Delta, you know, things do change, things do happen, but just so some of the people who've got time to play political games, you know, like some people in Victoria on the other side of politics who, you know, do nothing but play political games, don't read into that anything other than just I'm being a realist. We helped write the national plan. So anyone out there suggesting that we're not sold on it is just foolish and playing political games. I don't know what point Minister Robert was making. I'm making the point that the plan is the plan, and until there's an agreement at National Cabinet to change the plan, it remains the plan. I don't know, lyrics for a song or something, I don't know. But anyway, the plan is the plan. And we aim to implement it. And the quicker we all get vaccinated, the sooner we'll meet those 70 and 80% thresholds. And there are appointments available right now. Hopefully less than the 11,000 that I mentioned an hour or so ago. Hopefully people have acted on that and gone and made bookings, as has occurred right throughout the week. Any other issues?
One more question.
Sure.
Yesterday,
Just one? Just anyone?
So
right.
far.
Okay.
Xavier College yesterday announced that it was enforcing all its teachers get vaccinated. Is the state government working with any private enterprise to help them facilitate vaccinations in the workplace?
I think we're having discussions with a whole lot of different industries about potentially getting vaccines for them, and then they would then go and vaccinate their workforce. We're working with Coles, Aldi, Woolworths, Metcash from a supermarket distribution centre point of view, just as one example. I'm not aware of any arrangements with private schools, but you know, ultimately we just want to get as many people vaccinated as we possibly can, and I think partnerships have been important to this point, and they'll be even more important. There's a lot of people going through state hubs, a lot of people going to GPs, a lot of people who will soon go to pharmacy. That'll really ramp up soon, and I think there'll be lots of other industry partnerships. We're doing there's a lot of meetings, a lot of talk with people, and I think we'll have more to say about those soon. But I don't know that they include private schools. I don't think they do at this stage, but they might.
Sorry, the question is, how soon could we see companies rolling out vaccinations?
I think you're already seeing it now. There's already a bit of that activity going on now, but I think it may pick up pace and be a much bigger part of the vaccination rollout, a bigger thing, if you like, I think soon. And as soon as we can make those announcements, we will. Whether that includes elite private schools, I'm not certain. I don't know that we necessarily have many discussions with them at the moment, but perhaps. I think they're probably more likely going to making their own arrangements. Any other issues? If not, have a great day. Thank you.